Good afternoon, everyone. Sonia Liebendorfer here. I just wanted to do a quick video about cholesterol. We did one last week on blood pressure, and cholesterol is also a big concern, and they've made a lot of changes over the years as to where they want you to keep your blood cholesterol at. And I wanted to touch on that today because cholesterol is really needed by the body. So how low is too low, and when do we need to be concerned? And I wanted to also go into a couple of other things. Number one, I'm going to go into is we're looking for people to do stories about the way things that are really going on behind the scenes in nursing homes. I've talked with the people at Project Veritas. We're very interested in getting to the truth as to what's going on with our elderly in the nation. So if you work in a nursing home or you have a story that you would like to share, then I'm going to be going over that in the next slide. At the end of this, I'm going to be sharing a personal story just to give you some humor so you'll have something to take with you to hopefully brighten your day a bit. It's a nursing story about when I worked in triage in the ER and I had a patient that came in. So we're going to be going into the home remedies on that one. So without further ado, let's go ahead and get started. All right. Now, as I said, I have been talking with the people at Project Veritas. They are very interested, as I am, in exactly what's going on in our nursing home and assisted living facilities and everything with this COVID situation, because there was a lot of stuff that went on where my mother was staying that shouldn't have gone on. And so that kind of raised a red flag with me. If it's happening here, then what else is going on in our nation? So I spoke with them, and they are really interested in digging into this as well. So if you work in such a facility or you have a family member in that facility and you have had situations come up that you are concerned with the way that care is going on in that facility, then please reach out to them. The very last sentence of this, you will see I have listed their email. So make sure you send an email to veritastips@protonmail.com. Make sure that you let them know that you heard about this through Sonia, are in for a healthier you, and that they were looking for stories, because all of this mess that has gone on with Cuomo and all the cover up in New York, multiply that by how many facilities we have in this nation. What went on with my mother was not to that extreme, but still, we have to be concerned when the microscope is not on these facilities exactly what they're doing to our elderly population. So I encourage you to contact them. They can give you the undercover camera and everything to wear and give you instructions on that. But we need to place a spotlight on this problem in our nation. Let's get started with cholesterol, shall we? All right. Now, I can remember years ago when they first started talking about the connection with cholesterol and heart disease and how you needed to keep the numbers down and all of that. I think they originally started out around 220, and then they dropped it to 200, and then they dropped it to 160, and then they dropped it to 150 for total cholesterol. And then they've dropped it now to 100 for LDL, which is the bad cholesterol. And now they've dropped it down to even 70 for cardiac patients. And they're talking about they're discussing whether they should drop it to 60 or 50, okay? Now, they have continued to drop this, but is all of this lowering of cholesterol really healthy? Because your body does need cholesterol to perform certain functions. All right, so let's go into the difference. What do they mean by LDL? Low density lipoprotein. It has long been touted the bad cholesterol. That's why they want to get this number down so very low. And high density lipoproteins, and they have been long touted the good cholesterol because they're more complex. So what's the difference? The LDL is distributed in the peripheral tissues. That's why they're saying that it's so bad. It's the source of all of the plaques in all of the vessels. So the HDL, the high density, transports the cholesterol to the liver for excretion. Now, what actually goes on in the liver is there is an on and off switch. The body has its own way to make cholesterol, and what it does is it turns the on and off switch on and off based on demand. If the body is not needing to hold on to any more cholesterol, then the faucet's turned on to go ahead and eliminate it from the body. If the faucet is getting to where that, hey, cholesterol level's getting low, that faucet gets turned off and another faucet gets turned on to hold on to all of the cholesterol that you have because the levels are getting low. Because as we're going to go into it, your body needs a certain level of cholesterol, and these drug makers just seem to obsess on one thing. And for cardiac patients, basically, who have a heart history because of the connection with cholesterol plaques and heart disease, I get that. It's a big problem, and that's why they focus on getting the numbers down. But because of the tremendous side effects of these medicines that they come out with, I want to give you some alternatives. But first, I want to focus on exactly what it is your body needs cholesterol for, so you'll have a better understanding of exactly why it is needed. So let's get into that, shall we? All right, the first thing that you need to know is that cholesterol is used as a source of energy for your skeletal muscles in the form of triglycerides. Now, you've also heard of people having high triglycerides, but a lot of times it's a hereditary thing. And so we have to look at this thing as far as things you can change and things that you can't change, and genetics is one of those. It's one of those things again, just like we talked with your blood pressure. Genetics is the one factor you can't change. So if you have a family history of high triglycerides or high cholesterol, then that just means that you're going to have to even be more careful than the average person in making sure that it stays in check. Now, the first thing I want to talk about is cholesterol is needed for your sex hormones. You don't think about it, but progesterone, estrogen, testosterone, all three of those need cholesterol to be able to function and to form. Now, cholesterol is one of the building blocks of all of the cells of the body because it's in the cell membrane. So you have to have cholesterol for your body to be able to rebuild itself appropriately. Now, the other thing that you need to know is that cholesterol is what the body uses to make bile, which aids in the digestion and the breakdown of fats that you eat. So your body uses cholesterol in a multitude of ways, and this is only part of the picture. We're going to go over another slide that's going to cover even more of the functions of it. So your body does need it. That's why we need to be concerned about why are we getting so obsessive and getting these levels too low, because we don't want to get them too low that they're at a point that it's harmful. Your body needs cholesterol to determine how well the nervous system works. Because you see, it actually is needed for the myelin sheath, the sheath that protects the spinal cord. You need cholesterol to protect the sheath itself. Cholesterol is tied to how well the immune system can respond to illness. It's also needed for vitamin D production in the gut. Now, cholesterol, the last thing I want to bring up, it's the regulator of cortisol, aldosterone, and cortisone. Those are three very important things that you need to know, because this has to do with the fight and flight response. This has to do with the body's stress level. This has to do with the adrenal glands. So these are important factors to take into consideration when you're looking at lowering cholesterol. Now, like I said, the body has its own little regulation system, but when that gets out of whack, or through genetics when it's messed up because the genetics of the family has it out of kilter, and it just is supposed to be that way according to genetics, and it has to be fixed and tweaked, then that's when we have to worry about the consideration of the levels and how bad they are and when we need to medicate. Because I have seen people that have a family history of high triglycerides, and their blood comes out looking like milk. It's got this white, slicky appearance, and the triglycerides were over 1,500. So, I mean, there are genetic predispositions to having issues that you have to take medications for. But we don't want to get to a point that we obsess at this so much that we end up causing harm. And that's my concern here, is because every time you see a new guideline come out from American Heart Association, it's dropping it more and more and more and more. And they're saying, well, as long as a high density, the good cholesterol, as long as it doesn't drop below 40, they're okay. How did we come to that determination? That's what I want to know. Did something happen to somebody once it dropped below 40 for you to make that realization? Those are the kinds of questions that are in the back of my mind. Because I'm the puzzle person. I want all the pieces. Tell me all of the information, not just part of it. All right, so what are the things that get people into trouble with cholesterol? I've already told you about number one, genetics. That's the one thing you can't do anything about. If you have a family history of triglycerides over 1,500 or something crazy like that, or your blood is so thick that it looks like milk when it comes out because you have so much cholesterol in your blood, those are issues that are genetic in nature, that there's something going on, that your body thinks that that's the right number that it's supposed to have in its system, and you have to reprogram it and say, no, that's not right. We got to bring those numbers down. They really want it below 150. Because anything over 150, then they start saying, that we need to look at ways to bring it down, especially if it starts getting close to 200. They don't like triglycerides to go that high with your cholesterol levels. Diet. Well, how do you run into a problem with diet? Well, people take in a lot more cholesterol than what the body's needing. And so the on and off faucets that I talked about, I try to make things simple so it makes sense to you instead of giving you all the technical terms. But if you turn the faucets on and off and you try to take care of it yourself, but there's more there than what you really need, you can run into issues if you're kind of overloaded with it. Make sense? Diet. You take in the wrong types of cholesterol that you need. There are good kinds and there's bad kinds. Of course, everybody has heard a million times that the animal fats and all of that are what's bad. And the nuts, the omega-3s and all that are what's good. Smoking. Well, how does smoking contribute to cholesterol? Smoking contributes because it actually makes cholesterol stick to the blood vessel walls faster. Yes. It causes those plaques that rupture and cause heart attacks and strokes. Alcohol. Alcohol can cause a lot of damage. but they have found that if your medications allow you, talk to your doctor about that. They have found that 1 to 2 glasses of red wine a day help with raising good cholesterol levels. Now, a lot of people don't even bring this up because they're worried about people becoming alcoholics. But 1 to 2 glasses of red wine a day, they have found, is actually good for bringing up the good cholesterol numbers. Now, the medications and the statins and all of that, I want to bring those up because there are a lot of side effects with those that are concerning. Most notably, the myalgias, the muscle pains that are so bad, and muscle cramping that is so bad that it gets you to where you don't feel up to doing anything. Now, if you have a medicine that's causing you to feel that way, to me, there's a problem. It's dropping something too fast or too far or too low or too fast, too low, too fast, something. Because you shouldn't be having those kind of problems if you're taking a medication to lower your cholesterol. That's why I'm going to go through the supplements that I take at the end that my cardiologist told me about. I don't really have that much of a cholesterol issue, but at the same time, I don't want one either. But I don't obsess at keeping my levels ridiculously low because I think we're going to find out in the long run they're all wet about keeping these numbers so low. I think they're going to find out in the long run it's not such a great idea. But neither here nor there. I want to go on and tell you what you can reasonably do to lower your cholesterol. I would say if it's over 160. 160 is the latest local number that we have here. Total cholesterol over 160, then let's see what you can do about it. Now, they have found that diet doesn't really affect it, but up to 13%, they say. But the people that say that are the same ones trying to push the statins on you, so I'm not sure how much I believe that number. So let's get started, shall we? All right, so what can you do to lower your cholesterol? First of all, eat foods that are rich in omega-3s. Your fishes, salmon, your walnuts, your pistachios, flax seeds on your salads. Increase your soluble fiber. Eat oatmeal, eat oat bran, kidney beans, apples, pears, all of those that are full in fiber. Whey protein, they have found, lowers cholesterol and lowers blood pressure. So if you have both issues, you can find this in dairy products. Reduce the amount of animal protein that you eat, animal fat, in the red meats. You've heard this many times. I don't need to tell you that one. Reduce the amount of trans fats you consume. You've heard this one a lot too, and it's from the partially hydrogenated vegetable oil. If you see those words, stay away from it. Limit alcohol to 1 or 2 glasses of red wine a day with certain medications. This is a no-no. So make sure you check with your doctor and make sure that it's okay before you go drinking 1 to 2 red wine glasses of red wine a day. Because it's not in the best interest of everybody. But it does help raise the good cholesterol, the HDLs. And it does help to protect with the HDLs. Helps lower LDL. Now, stop smoking if you smoke. And the reason I say that is twofold. Number one, it affects your blood cholesterol because it makes them stick to the walls and they don't get out of the body. They stick too fast. I want you to think of putting a Gorilla Glue on something, okay, and then releasing it out, and what's the first thing that happens? The very first thing that it comes to, it sticks and it's not going to let go. I want you to think of cholesterol like that with your blood vessels, okay? Because if you smoke, what happens is all of that cholesterol sticks to your blood vessels instead of the body getting rid of it the way that it needs to. Now, I don't know what it is about the cholesterol that makes it adhere instead of being able to be transported and out of the body, but for whatever reason, for smokers, it causes the vessels to clog up. It makes the cholesterol stick to the vessels, which makes those pathways for blood narrower. And so because the pathways for the blood flow is narrower, what other thing is going to happen? Your blood pressure is going to go up because it's going to take more work for your heart to get the blood where it needs to go because it's got a narrower pathway because of the cholesterol buildup. Do you see how all of this comes together now? Yeah. It's all starting to make sense. It's all starting, the pictures, all of the guidelines and everything they always tell us. I'm trying to bring all of that stuff together for you so you understand it better, so it makes more sense. Because if it makes more sense, people are more likely to do better. If they don't understand the whys of something, they're not going to do it. So my hope is that I can help you understand the why of making the changes. All right, let's go on to the next slide. Now, how can you reasonably lower it? We're going to talk about those alternatives over the counter to the statins in the next slide. All right, now the first one I want to talk about is red yeast rice because that's the one that my cardiologist recommended. You can get it over the counter. It's in the supplement section at Walmart. You can take it. She said it is exactly the same thing as Lipitor, only it's in its natural form. It doesn't have all the synthetic fillers and all that other crap that Big Pharma puts in stuff. So it's in your vitamin section. Make sure you talk to your doctor about the other medications you're on because you don't want this to interfere with something else that you're already taking. If you're already on a medication, you don't want to be taking a whole bunch of statins and then this too, because you can run into problems with your liver, okay? Talk to your doctor about it. Tell them you want to try and see what the red yeast rice does, because that's what I told my doctor. You know, and he wanted me to start taking statins. I'm like, no, I'm going to take red yeast rice and we're going to see what happens. And the red yeast rice brought it down. And my doctor actually started telling other patients to start using the red yeast rice. Amazing how that works, right? Amazing. Just takes one person to make a change. Keep that in mind, people. Be the change you want to see. Now, niacin is the other thing that you can use to lower blood pressure. I recommend trying this one first. If you don't have a whole lot of difference that you have to make, if you don't have to lower it that much, try niacin first, because usually extra niacin in and of itself, it's a B vitamin, normally it will, help itself get the numbers down to where they need to be. The best thing you can do is exercise. Exercise, exercise, exercise. Burn off the excess cholesterol. That is very important. But red yeast rice was my go-to because niacin didn't really lower mine enough. Didn't lower it enough, so I switched over to the red yeast rice. You can take 2 capsules a day, 1,600 milligrams, thereabouts. And it will help to lower the cholesterol. You take it at night, you take it just like you would the Lipitor, only it's over the counter, cheaper than all of these big pharma drugs, and it's natural, doesn't have all the added fillers and all of that stuff. So, like I said, talk to your doctor about this before starting it, and you don't want to be on this along with other statins and stuff because it's not good. It can damage your liver. All right? So there is that information for you. And I also want to go over what is too low and the signs and symptoms you start seeing if it does drop too low. We're going to cover that in the next slide. All right, so what happens if your cholesterol runs too low? If your faucets aren't turning on and off right and getting to where they can not regulate it properly and you have to rely on medication and that kind of thing. Well, the Mayo Clinic has talked about several conditions that can be caused by your cholesterol dropping too low. So let's talk about these. Cancer. It can cause cancer. No specific type was mentioned. It just said cancer. It can cause cancer. Hemorrhagic stroke, which is a stroke caused by bleeding in the brain. Low birth weight of babies, of pregnant mothers that are obsessed about their cholesterol levels during pregnancy. Depression and anxiety. Now, those can be symptoms of many different things, but those are what they have come up with as far as conditions from your cholesterol being dropped too low. And with that, let's go on to my funny story that I'm going to tell you about on the next slide after my thank yous to all of you for being here. All right, I want to thank each and every one of you for being here today. Out of all the places that you could be spending your time right now, I appreciate you being here, learning about cholesterol and why we have to be careful about our cholesterol levels and the dangers of lowering it too much. Remember to please like and subscribe if you have not already, and share this video with anybody that may find it of interest. If you know anybody that may have a story that they can contribute to Project Veritas, please share their email with them and get them the information that they need to get cameras, to get the undercover stories for us, to expose what's going on with America's elderly populations in assisted living centers and also the nursing homes. And now for my funny story to share with you. Back years ago when I was in triage in the emergency room, I had this young lady come in, and she was in a lot of pain. She was holding her ears, and she was just rocking back and forth, holding her ears. And the person that was with her told me that she was having difficulty, with hearing, and that she was hearing impaired. And he was pretty much telling me the story of what was going on with her because she was in so much pain. She was just crying and rocking back and forth. So I got the story from him as to what was going on with her, and he told me that she was just in tremendous pain in her ears and that it just would not stop. So I sent her over to the fast track area because that was the area of the ER that you could get seen quickly if it was something that they could just do, basically get you in and out of there fairly quickly. So I sent her over there to be seen. A little while later, the fast track nurse comes over to me and she says, "Sonia, you're not going to believe this." I said, "What?" And they said, "Remember the person that was rocking back and forth with the ears and all of that?" And I said, "Yeah." She looked like she was in considerable pain. They said, "Well, Sonia, she has an understanding that a home remedy of sticking garlic cloves in her ears will help with ear pain." No. Yeah, she did that. She's got 2 garlic cloves, one stuck in each ear to help with her ear pain. Where did she get that idea? Oh, it's an old wives' tale that if you stick garlic cloves in your ears that it'll help with ear pain. Okay, let's set the record straight now, people. Garlic cloves do not help with ear pain. Shoving garlic cloves in your ears does not work for ear pain. As a matter of fact, with the size of a garlic clove, it seems like it would make it even more painful than what it already is. But anyway, that is my funny story for today. Home remedies. Oh, I've got thousands of those kinds of stories for you, along with many more. But I hope it made your day, hope it made you smile, hope it made you laugh, because that was my intention. And y'all take care, and I will be talking to you soon. And please get in touch with Project Veritas if you have a story for them, and get a camera from them so you can go undercover. This is RN for Healthier You. Take care, y'all. Bye.